Hi Haley, how are you today?
I'm doing okay. How are you?
I'm doing good. We're here today to do your intake forms and to go over everything we need to do before we start counseling. Does that sound good?
Yes.
Do you have any questions or concerns before we get started?
No, I don't think so.
Alrighty. What is your full legal name?
Haley Dawn, Daun, Eminger, Eminger.
I love your middle name. It's very pretty.
Thank you.
What is your date of birth?
February 8th, 1994.
Alrighty. And today is April 13th, 2025. Okay, so what is your chief complaint and the main reason why you're coming here to get counseling?
I just need help dealing with anxiety. I think it stems from postpartum. So I just need help on dealing with that.
When you say it stems from postpartum, can you expand on that a little more?
I've always been an anxious person, but I think my anxiety got a lot worse after the birth of my daughter 3 years ago. And I have good days and bad days, but I think the majority of it is the hormone shift from postpartum.
Alrighty. Makes sense. You said you have always had anxiety. Can you tell me more about the history of that and like what your anxiety looked like before you had postpartum?
So, I mean, as far back as a child, I used to, not want to go to school and say that my tummy hurts and be scared to go even eat in public. But it was always manageable before I had a child. And now that I've had her, I have like even more intense fears of going out in public, even going to the grocery store can be really hard. And I've always, thought those anxious thoughts prior to having a child, but really after the birth of her, it just got worse and more unbearable.
Like how was your anxiety bearable before, but now it's not? What's kind of the main difference from before and after?
I used to be able to shake the feelings of uneasiness or like the frightening portions of going outside or in public or being in large groups. But now, like, I've literally driven to the grocery store and I can't shake that feeling of uneasiness, and I won't get out of my car and I'll just go home instead of doing the task that needs to be done.
Yeah. Well, I'm sorry you're experiencing that. That sounds like a lot to deal with.
Thank you.
Have you ever had any sort of past psychiatric or medical problems?
No.
You've never been hospitalized or had been on any sort of medicine for any psychological problems?
No.
What about any medicines? You've never taken any sort of medications for any? Have you ever been on any anxiety medicine?
Yes, I have.
Do you remember the names of them?
I tried Zoloft a few months after I gave birth, and I did not like how it made me feel. And now I am on, what's that one called?
Prozac?
Yeah, fluoxetine.
And you think the Prozac helps a lot better? It makes you feel better than the Zoloft did?
Yes, very much so. When I first started taking it, There was 2 weeks where I felt worse, but I googled it a lot, and it said that it's normal to make you feel worse before you feel better. So
Yes. Good job Googling that.
thank you. Dr. Google's my fave.
Yeah, there's like an adjustment period for your brain, kind of realizing what's going on and to how to incorporate the new medicine it has.
Yeah.
But how long have you been on Prozac for now?
2 years, I would say.
Do you think you're going to be on Prozac forever?
Well, the anxiety of not being on Prozac scares me because I know how I felt before, and I'm also scared to like withdraw from it. I don't know. I have really bad health anxiety, so I'm scared to make any changes with anything that makes me feel better or worse or.
Yes. Well, yeah, that's good. There's no long-term like downsides for taking Prozac forever, so don't feel any pressure to stop taking it. Okay. Clinical dependency. Do you know what that means?
No.
Okay, so clinical and chemical dependency and treatment. Have you ever had any medicine or substance like alcohol or anxiety medicine or food even that you are dependent on and you can't live without?
I do like my wine. I feel like it helps me forget about the anxieties of the day. Kind of lets me relax.
Yes. Have you ever had any sort of treatment or thought alcohol was a problem?
I don't think so, but my mom has mentioned that I might be too dependent on it.
Um, okay, have you ever had any blackouts, tremors, or seizures?
No,
Okay.
I don't think so.
Has anyone in your family ever had seizures?
No.
And then, has anyone in your family ever had any sort of bad psychiatric problems or have ever been committed to a psychiatric hospital or had any sort of serious mental illness like bipolar or schizophrenia?
I know my mom deals with anxiety and depression. I don't think she's ever been admitted, but I'm not positive.
Alright, and then no other like grandparents, cousins, aunts, uncles that you can think of?
Not that I know of.
Okay, have you ever had any sexual or physical abuse?
No.
Okay, now we're going to talk about medical history.
Okay.
Have you ever had any sort of surgery or hospitalizations for some kind of medical problem?
I mean, nothing more than like getting my wisdom teeth removed, my tonsils taken out, childbirth.
Okay, those are surgeries. Yeah, technically those are surgeries.
Yes.
So technically, I guess they are part of this. did anything bad happen with? Did anything happen with your childbirth that I need to note?
So I actually had COVID when I gave birth, but I didn't know it at the time. I was a teacher and I was due right at the beginning of the school year, and I was so sick, but my principal made me work the first 2 days of school. It was a Thursday and a Friday, and I had a doctor's appointment to check on the baby that Friday. My blood pressure was completely normal. I wasn't feeling good, so I told my doctor that, I think I might have a sinus infection. She prescribed me a Z-Pack, and I started taking that. Well, Saturday, I slept all day. Then I thought my water had broken, so we went to the hospital, and my water didn't break, but my blood pressure was 181/100. They didn't test me for COVID then, but now knowing what I know, I think it was the COVID that made my blood pressure go really high. But my blood pressure didn't get better after her birth, and it took about 6 weeks to regulate. And then I got a really unhealthy habit with checking my blood pressure. I was very obsessive with checking it. I would check it multiple times a day, every day, and sometimes it would be normal, but sometimes I think the anxiety of me checking it would make my blood pressure higher. And now I kind of have an unhealthy relationship with my blood pressure being taken at the doctor. Anytime they take it, I freak out about it, so it makes it higher.
Yes, that actually happens a lot when going into a doctor's offices. A lot of people have a lot higher blood pressure than it really is.
Yes, because we're stressed out about it being high, so it is high. It's called white coat syndrome, right?
Oh yes, wow, good job. Okay, but after all of that, and after your blood pressure finally regulated, did you have any sort of complications, like, still that you deal with from the birth?
No, other than anxiety, no.
Okay. All right. Have you ever had a history of head trauma?
No.
Do you have any allergies?
Cats.
Cats and pollen?
Yeah, cats and pollen.
Do you have any spiritual concerns?
I don't think so. I don't know what that means.
Yeah. It has a place to note if you have any spiritual or religious practices that are very important to you, or you have any concerns about.
No, I don't think so.
Alrighty. Alright, now, this next part, they're called biopsychosocial factors. It's kind of factors that all around affect your biology, psychology, and sociology.
Okay.
And so I'm gonna read you a little symptom, something that most people struggle with or have issues with, and you're gonna give me a scale from 0 to 5. 0 is no symptom at all, you never feel that way, and 5 is extreme severity, and you feel that way almost or on a daily basis.
Okay.
Okay, the first one is feeling sad or lonely.
1.
Right. Having, hold on 1 second. Okay, having low energy.
I say 2 or 3.
self-esteem.
3.
Having suicidal thoughts.
0.
Having hallucinations.
0.
Having palpitations.
0 lately.
Manic behavior.
0.
Having worries.
I think I worry about as much as the average person. 2. 3.
Low frustration tolerance. Do you get frustrated easily?
No, I'd say 0.
How about poor appetite?
No, 0.
Overeating.
I'll give that a 1 because I feel like I could watch my portions a little bit, but I don't snack a whole bunch, so
What about insomnia?
no.
You can fall asleep pretty easy.
Yeah. I fall asleep very easily.
Restlessness.
No.
Poor concentration.
No.
Abusing drugs.
No.
Okay, the next one is anhedonia. Do you know what that word means?
No idea.
Inability to feel pleasure. So, like, have you lost interest or pleasure in things that normally make you happy and give you pleasure?
No.
Okay. Irritability.
Well, I'm a female, so we'll give that one a 2.
Okay, anxiety.
4.
Panic.
I haven't had a panic attack in a while, but I don't want to give it a 0 because they still do happen and can happen. Let's give it a 2.
Well, what about like when you were talking about not being able to go into the grocery store? When that happens, is that sort of a panic feeling?
Yeah, very much so.
But that hasn't happened that much lately.
Not lately, no.
Okay. What about delusions? It's kind of believing something that's not true.
No, I don't think so.
Hallucinations are hearing and seeing things that are not true, and then delusions are believing a thought to be true when it's not.
No, I don't think so.
Neither of those are.
No.
Okay, guilt.
I think it's easy to feel guilty as a mom.
Yeah.
Mom guilt is real, so I did 2.
Okay. Mom guilt. I've also heard the term mom brain. Is forgetfulness one that happens a lot?
Yes. Yes, very much so. A lot going on when you have to take care of another tiny human.
What number would you give forgetfulness?
Probably a 2.
What about worthlessness?
No, I don't feel worthless. A 0.
What about somatic complaints?
Excuse me?
So somatic is a weird term. It just kind of relates to the body. Have anything hurt or felt really weird in your body or brain that shouldn't?
Not lately, no. I think before medication, I would give that like a 4. But after medicine, a 0.
Oh, good. Well, that's great. What about obsessions or compulsions? Obsessions are kind of thinking about things over and over again and not letting it go. And then compulsions are behaviors that you kind of feel like you have to do to release and diminish your anxiety. Like some common compulsions are checking that your car is locked multiple times. Have you ever had any of those?
I have had them. I more had obsessive thoughts before the Prozac. Like thinking I would take my daughter on a walk through the neighborhood and I would think somebody was following us and I couldn't let that go. And then I would like make plans in my head of what I was going to do if someone pulled up and tried to take us. And it wasn't just once or twice I thought about that, it was the entire walk every time I took the walk.
Oh, no.
And same the grocery store thing. If I could muddle up the strength before medication to go inside the grocery store, I'd be walking around with her, convinced that there was going to be someone in the store with a gun and they were going to like shoot everybody, something like that. And it just wasn't one time. It was the whole time I was walking in the store, or yeah, just all the time. And then I would also have obsessive thoughts that I was going to have like a seizure or something bad would happen to me. It was never with my daughter. I was never worried anything was going to happen to her. It was always just with myself. And I think just that anxious feeling in my body didn't feel comfortable, and I told myself that I was going to have a seizure, and that's why I felt like that.
Oh, no, I'm sorry. I'm sure that was very scary.
Yeah, it was.
Does it feel good knowing that you don't think that way anymore?
Yes, very much so. That's part of the reason I'm scared to stop taking Prozac, because I know what that feels like, and now I know what it feels like without those thoughts,
Yeah.
and it's much better now.
Oh, good. I'm glad it's much better.
Thank you.
Oh, the next question is present medication. Let's take a look at that. Okay, so Prozac is the only one.
Yes.
Do you happen to know how many milligrams it is?
I think it's 20.
And then you take it once a day?
Yes. I also take Zyrtec.
Okay. Have you had any bad side effects to Prozac other than just the beginning 2 weeks?
No, I don't think so.
Okay, the next one is current drug, alcohol, and tobacco use.
Mm-hmm.
Do you use any sort of illicit drugs or use tobacco?
No.
Tobacco. And then tell me a little bit about your alcohol use.
I probably drink half a bottle to a bottle of wine every night.
Alright. Work. The next question says work, school, role, function, leisure, and hobbies. Tell me a little bit about your work. I know you're done with school. Tell me a little bit about your work, what it looks like, and then tell me about your home life, like your leisure and hobbies.
Okay.
What kind of takes up your time?
So I'm a preschool teacher. I teach 2 to 3 year olds. I really enjoy that. I'm at a great school where I don't take any of my work home, and that's a first. in my teaching career. Usually I would spend all day Sundays working. I really like my job. They're very flexible and understanding, so they have a good work-life balance. And then my home life, I live with my boyfriend and I have my daughter every other week. And I'm happy. I enjoy going home. I look forward to going home every day after work. Yeah, I like to work out. I like to shop. We have a dog and we take her on walks. Most of my time is spent during the week taking my daughter to and from extracurricular activities. She loves dance and cheer. I'm playing Barbies and Play-Doh and doing all of the mom things. I also really enjoy cooking, although sometimes my energy level after, working all day and then taking her from place to place, I don't necessarily want to cook. But I do enjoy it.
Oh, good. Well, that's great. I'm happy to hear that you're happy. All those activities sound great. Sound like you have a good life set up.
Yeah, it's pretty good.
The next question is family and psychosocial factors. Living situation or financial. Tell me a little bit about your house, your finances, and your family.
Well, I'm a teacher, so I don't make very much money. We live in a very nice apartment, and I'm grateful to my boyfriend who pays half of the rent and is in a better financial situation than I am. Yeah, I mean, I always think I'm broke, but I still always manage to provide for my family, and I'm still able to do things, and I have a hard time sometimes reminding myself that, yeah, you may not have as much money as you want, but you are also doing a lot better than other people in the world. So.
Well, good. I think that's great. The next one says family genogram. But you said you don't know much about your extended family members, right?
No, outside of like my mom, my dad, my papa. Yeah, really just like the closest ones to me. I know a little bit about. I know my dad has high blood pressure.
Okay, now we're going to do two. It's already been 30 minutes already. Okay. The next part is protective factors and risk factors. Okay, so protective factors are things that impact treatment positively.
Okay.
So like the first one, I feel like you have a good attitude and healthy mindset about your situation and everything that's going on with your life. So I'm gonna highlight that your personal characteristics will positively impact treatment.
Okay, great. That makes me feel better.
I think you also have a very positive social orientation. I feel like you have really good people skills and can connect with people easily. Would you agree with that?
Yes, I would say so. That's what people tell me all the time.
Would you say that you are more intelligent or more resilient?
Resilient.
Okay, I think those are good. I think your personal characteristic and attitude, your positive social orientation, and your resilience will help you positively impact treatment. Okay, now the risk factors. Sorry, I have something in my eye.
Okay.
The risk factors are things that might impact treatment negatively.
Okay.
So the first section is community. Do you have a big availability of drugs because of your community that you live in?
No.
Do you have societal norms in your community that are favorable to drug use?
No. If you would have asked me in high school, I would have said absolutely. But now I'm too old. I don't even know where to get drugs.
And then do you have extreme economic deprivation?
I don't think so.
I don't think so. Okay, the next section is family. Do you have a family history of destructive behaviors?
What would you consider destructive behavior? Like
Someone who drinks or does drugs too much, someone who gambles too much, someone who chooses pleasure over their family repeatedly.
when I was in high school, my mom did drink a lot after her and my dad got divorced, but she's gotten a lot better now. So currently, I would say no.
What about family management problems or family conflict?
No.
Okay, what about school and work? I don't think any of these apply to you.
Okay.
You definitely don't have a lack of commitment to your work. Do you have friends who engage in destructive behaviors?
No.
Do you have a genetic predisposition to drug or alcohol?
No.
Okay. Well, that's good. You don't have any of the risk factors.
Great. I'm cured.
You're cured just like that. Okay. Now, the next section. The next section is substance abuse and mental health screening results. So we're going to do 2 tests. The first one's called the Beck Anxiety Inventory.
Okay.
The second one is an alcohol use screening questionnaire. Alright, so below I'm going to be reading you a list of common symptoms of anxiety. Please carefully think about each item and indicate how much you have been bothered by that symptom during the past month.
Okay.
So I'm going to read you a symptom, and then you're going to tell me, based on thinking about your past month, has it affected you not at all? Has it affected you mildly, but it didn't bother me much? Moderately, it wasn't pleasant at times, or severely, it bothered me a lot?
Okay.
0, 1, 2, 3. 0 is not at all. 3 is severely, it bothered me a lot.
Okay.
Numbness or tingling?
0.
Feeling hot?
0.
Wobbliness in legs?
1.
Inability to relax?
0.
Fear of the worst thing happening?
I think 1.
Well, what about when we're talking about how, like when you're going into grocery stores, Isn't that the fear of the worst thing happening?
Yeah, but in the last month that hasn't occurred.
Okay. Dizziness or lightheadedness?
I say one. Happens sometimes, and I know it's anxiety, so I sometimes can stop it.
Heart pounding or racing?
In the last month, 0.
Unsteady?
0.
Terrified or afraid?
0.
Nervous?
1.
Feeling of choking?
0.
That's a funny one. Hands trembling?
1. That did happen a couple weeks ago.
Shaky or unsteady?
Yeah, 1.
Fear of losing control?
0.
Difficulty breathing?
0.
Fear of dying?
1.
Scared?
1.
Indigestion?
Ooh. 2.
Faint or lightheaded?
1.
Face flushed?
1.
Hot or cold sweats?
0.
Okay, so your total for the Beck anxiety inventory is 11. And a grand sum between 0 and 21 indicates very low anxiety.
Great.
So that's great. This is usually a really good thing. So yeah, a grand total over 36 is a potential cause for concern, and usually they need medication or therapy if it's over 36. But you only have a score of 11, so that's really good.
Great news.
Yes. Weren't some of those questions weird?
Yeah.
Like, why is wobbliness in legs or lightheadedness part of anxiety?
I know. Some symptoms, though, and I think I'm learning that with myself because I have such bad health anxiety. Sometimes I'll notice something like I noticed my legs were a little bit wobbly in the shower the other day, but I did a check with myself and I'm like, oh, I do feel a little bit anxious. And instead of spiraling down that path of, oh my gosh, something horrible is wrong, I've just started to recognize my anxiety symptoms.
Oh, good. That's awesome. I'm proud of you. Okay, the next one. The next one is called the audit. And it is an alcohol screening questionnaire. It says drinking alcohol can affect your health and some medications you may take. Please help us provide the best medical care by answering the questions below.
Okay.
And if you look at this, it says 1 drink is equal to 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of liquor.
Okay.
And then the 4, you can look at this one. These are the 5 different categories. Never, monthly or less, 2 to 4 times a month, 2 to 3 times a week, or 4 or more times a week.
Okay.
So how often do you have a drink containing alcohol?
4 or more times a week.
All right. How many drinks containing alcohol do you have on a typical day when you are drinking?
3 or 4.
How often do you have 5 or more drinks on one occasion?
Monthly.
How often during the last year have you found that you are not able to stop drinking once you had started?
Monthly.
How often during the last year have you failed to do what was normally expected of you because of drinking?
Never.
Well, that's good. How often during the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session?
Never.
Well, that's good. How often during the last year have you had a feeling of guilt or remorse after drinking?
Never.
Never. How often during the last year have you been unable to remember what happened the night before because of your drinking?
Never.
Have you or someone else been injured because of your drinking?
No.
Has a relative, friend, doctor, or other healthcare worker ever been concerned about your drinking or suggested you cut down?
No.
Have you ever been in treatment for an alcohol problem?
No.
Okay, I gotta add them up. Alright, so in this one, you have a score of 9. And that is the risky zone. But it's still in the bottom half of the scoring. It says someone using alcohol at this level could develop health problems, or existing problems may worsen if their drinking gets any more severe.
Okay, good to know.
But yeah, I mean, you didn't have any like yes answers to the more serious questions, so I think I'll be okay.
Okay.
If I haven't drink in the morning, I want. All right, we are almost all done with everything. So I'm doing a mental status exam on you as we do this intake process.
Okay.
You have a very neat appearance and good eye contact. I feel like your mood has been very positive as well. How would you describe your mood in one word? You have either options of anxious, angry, depressed, euphoric, or irritable, or other.
My general mood today is, I'd say, content.
Content, I like that. And you don't have any sort of cognitive or memory impairment?
Other than modeling.
Other than memory. And then your perception is very good. We talked about you don't have any hallucinations or delusions. You don't have any suicidal thoughts or thoughts about hurting someone else.
No.
And you have had a very cooperative and you've had very cooperative behavior, and I appreciate your honesty on everything.
Thank you.
So yes, we did the Beck anxiety inventory. We did the audit, the alcohol inventory, and the mental status exam. Now the last few minutes, we're going to be going over kind of what you want from me. And kind of just about your diagnosis and treatment going forward.
Okay.
Have you ever had a diagnosis from a mental health professional?
Yes, a generalized anxiety disorder.
Have you ever been diagnosed with anything else?
No.
Do you think you need any medication management, or do you think your medicine's been going good?
I think it's been going good. I don't think I want to increase it. I think I just want to learn how to deal with my anxiety better and use different techniques to do that.
Yes, and that's what we'll do in the future is teach you lots of coping strategies and techniques and tools to combat and deal with your anxiety in a more healthy way. You wouldn't be interested in group or family counseling, just individual?
Yeah, just individual.
Okay, some target goals and objectives for going forward. I'm just gonna read these off and say yes or no if you want to work on these.
Okay.
Establish compliance with meds.
No.
Improve your thought processes.
Yes.
Improve frustration tolerance.
Yes.
Improve alteration in nutrition.
No.
Lift or stabilize your mood.
No.
Improve impulse control.
No.
Decrease anxiety or fear.
Yes.
Improve your parenting skills.
No.
Diminish drug abuse.
No.
Diminish self-defeating behaviors. That can include alcohol.
Yes.
Decrease pain.
No.
Improve your sleep pattern.
No.
Decrease risk factors.
Does that include alcohol?
No. But then what are some other things that you want to work on in counseling? And what are some things that you would want me to help you accomplish?
I think just recognizing when it is anxiety and not thinking the worst with my health, if that makes sense. Just recognizing when it's an anxious thought versus something's really going on.
Okay. My main theoretical approach I use is CBT, cognitive behavior therapy, and that will help you have more control over your thoughts and learn. It'll help you teach you how to recognize those dysfunctional beliefs that are not true, and then how to sort of teach you to replace it with a rational and true thought. CBT will help you have more control over those thoughts and how to recognize it as anxiety or not.
Okay, that sounds perfect.
Yes. Right. We're almost done. I don't think you need any sort of other referral. Yeah, you don't need any. Okay, I think that's it.
Okay.
We're all done.
Thank you.
Yes, do you have any other questions or concerns for me?
No, I'm excited to continue seeing you.
All right, thank you. I'm excited too. I think we're gonna make a lot of good progress together.
Yes, for sure.
Well, hope you have a good day. I'll see you for our first session next week.
Thank you.
Goodbye.